morning, everyone. You live on Enchicoe TV. Today happening to be a health screening, a free health screening here in Enchicoe. And this particular initiative is being organized by our acting principal in the person of Dr. Emmanuel Adom Eshen. After bringing this initiative, he has been able to put or organize people, experts, to come here to embark on this particular project. This is how the whole section is going to be. We are going to be having presentations of health talks. We are going to have blood donations and other gifts to students who participate in this particular program. So I have with me here my co-host in the name of
Adeche Justice.
all right, so we'll be taking you to the whole section, the whole process. Whatever goes on, even if a pin falls, we will let you know.
So please kindly stay tuned.
All right, thank you. All right, so we're still at the health talk session happening in Enchi College of Education. The process is still in section. The medical health personnel in the auditorium giving us good education on our health as to when you talk about obesity, blood donations, everything is in section. And from here, we're going to give you updates on whatever happens in the auditorium. So this is how the section is still in process. We will go to the medical personnel and have talks with them as to how the process is going to be when it comes to the donations of blood. People have a lot of fear as to this process, so we are going to get in touch with the medical personnel for a talk to interview them why it is necessary to embark on certain activities like this. Thank you.
Good morning once again. You are welcome to Enchicoe TV. Yeah, we are here with our principal, Dr. Adom Eshen. Sir, you are welcome.
Thank you very much.
All right. So please, I want to know how you organize the program.
Thank you very much. The college is into training and ensuring the holistic development of every student, staff, and the whole community. So, as part of my vision for the college, to transform the college into a 21st century model where we can have good health in good body, I decided and I liaised with the government hospital team. Health Day. This day has been set up solely to take care of our health, and this is the plan. The plan is that we don't only do academic work, we don't only do teaching and learning, but we also want to ensure that we have a sound body ready to sit in the lecture hall to learn. So the medical team, or we have a team, the hospital team, in conjunction with the college management team, we visited the government hospital, met the medical superintendent, and then we planned the program together. That today we're going to have two sessions, one session purely for the staff and another session for the student, and they are going to run concurrently. Now what we are going to do is that as the students have their session, the staff will also have their session. The reason why we have two is that we don't have the same health needs. Age goes with health implications, so those in the 40s and 50s have gotten their different health needs, whereas students within the 20s to the 30s who are young and exuberant also have their health needs. So we can give attention to each of them. Again, when we have the staff and the student together, they will not be able to freely express themselves. So we decided to allow the students to have their free will to express themselves and then ask questions they want to ask, whilst the staff can also have their session. So the morning session is for talk. We're going to have various talk shows, talk on various health, wellness, everything. Then the second section will include screening, blood donation, and all other things that relate to our health, so that we will be giving the basic advice, basic necessities, so that we can continue our academic life very well. It is very necessary at this time because in the near future we're going to have our quizzes, we're going to go into subject projects where we need strength and enough health to do these things. That is why we are consciously doing this now, so that we can have enough strength and health to continue the academic calendar very well.
God bless you. God bless you.
Thank you very much for the opportunity, and I hope you also pass by or through the various sections to capture all the other activities we are doing for the day.
All right.
Wish you all the best for the day. Thank you very much.
You're welcome.
There are a lot of things that we take inspiration from as a company. We are basically a prospecting company within the Awe municipality. And we have been here for a couple of years. As a company, we have some three major thematic areas as part of our corporate social responsibility issues. One of them is to pick up issues in relation to health. One is to provide potable, water, drinking water to the communities within the areas, and then also contribute towards, good education within the area. So, and while this issue is about health, so it is part of our thematic area. So for that matter, we have great interest in making sure that we contribute to the health of the community members, including students and the areas within the area. So we are highly motivated to embark on such journeys and we need as well. So for now, we don't really have a challenge. What matters is once the you come out with your plan and you present it to the company looks at it. So long as it falls within the thematic area that are of interest to us as part of our corporate social responsibility issues, of course, it is presented to management and it is scrutinized, gone through the processes. Once it is considered, then the package will surely be given. And of course, once that is done, we follow up like we have come to come and see to it that the reason why we are giving out the contribution is done properly according to what is being presented to the real. There is not really a challenge to sponsoring such programs. All we need is to go through the normal process. Once it satisfies the conditions, then that's good. Yeah, for now we are highly impressed.
All right.
As a team, we are highly impressed. You look at how the system is structured, things are well done properly. You look at the management of the school, the organizers of the program, Enchi Government Hospital, and then the principal of the training college as well. And in fact, the students who are cooperating, because there's one way organizing the program and there's one way getting people to participate. So you look at the numbers, in fact, we are highly impressed, and we are hoping that going forward there will be further collaborations in ensuring that the proper thing is done as planned. So for now, all we want to say is that is every great leader has a mission, and we want to say that no grace is supposed. So that I'm hoping that God will give you the grace to be able to have that ability to put outside the at the end of the day, all benefit the freedom that the community life. Not only ours. Once it's contributed to that, we are grateful to the opportunity that other people are going to benefit from that. That's it.
So we've also realized that here in Ghana, most institutions or associations find it difficult to support institutions to embark on projects like this. So what do you have to tell them, please?
Yeah, I think some of the reasons why people divert funds is lack of supervision. You come in for a fund and you divert it, and we don't follow up. That is where situations turn around. But if there is that constant supervision, then the intended project can happen. Yeah.
All right, thank you so much for your time. And that is it from the minds here in Enchi.
An exploration
Okay,
company.
so we want you to introduce yourself more to us.
Yeah. Like I said earlier on, Michael Quinn.
Okay.
I am the ESG officer.
Okay. So what actually is the company about?
We are exploring for gold.
Okay.
Very soon we'll be entering into production.
Okay. So what's the name of your brand?
Cape Coast Resources.
All right.
Newcore.
Newcore. All right. So that was Newcore. We have a short conversation with Newcore, having been a sponsorship to the free health screening here in Enchicoe. Thank you so much for your time.
Thank you.
Thank you. We're still live on Enchicoe. Fortunate for us, we have one of the medical doctors from Enchi Government Hospital, and we're here to have a short conversation with. Good afternoon. Welcome to Enchicoe TV.
Good afternoon. Thank you very much.
All right, please, may I know your name?
Yeah, so I'm Dr. Emmanuel Kumsi. I'm the medical superintendent of Enchi Government Hospital.
All right, thank you so much. Okay, so today happening to be a free health screen here in Enchicoe. We'd like you to give us highlights on this particular initiative.
Yeah, so it's a wonderful initiative led by your doctor principal, Dr. Adam, and then with the sponsorship from Cape Coast Resources. prospecting, gold prospecting company in our main area, and then powered by Enchi Government Hospital. Yeah, so our staff are here to carry out the activities.
All right, thank you so much. Okay, so I think I learned early in the morning you have an educative section, and right now we are having the screening and that stuff. So please, how can you take us through the process?
Yeah, so early in the morning, what we had was a few lectures on various topics. So we talked about issues that concern students in Enchi College of Education. So it has to do with HIV, sexually transmitted infections, drug abuse, betting. These are issues that are coming up. Contraception, and then we also did a few talks on the screenings that were going to take place. So blood donation, who qualifies to donate blood, and then those who can be helpful to us, because we need a lot of blood in the hospital for our clients. ENT, ear, nose and throat issues, we had a session. Eye, we had a session, and dental, those with the problems with their teeth and the rest, we also had sessions with them. And we had a separate session with the staff. They are older and their group, they have special problems. So we talked about the prostate, prostate enlargement, prostate cancer, and then prostate infections. Like we had a very good session with them. So this afternoon, we are now having the screening itself. Yeah, so those who are interested in knowing their HIV status, they can test for HIV. And then those who need commodities, we have a lot of condoms, a lot of contraceptive devices available for students. Those who want to really have the doctors have a look into their mouth, examine their eyes, and then look in their ears and throat, and noses, yes, they are all available. We also have the wellness clinic also operating here. Okay, so here we are looking at the weight, your height, your BMI, your blood pressure level, your blood sugar levels, and all these are free. Sponsored by Cape Coast Resources, as well as the Enchicoe administration, and then the Enchi Government Hospital.
All right. Thank you so much for this initiative. So we would like to know if one comes and that particular person's been affected at a particular spectrum that he was diagnosed of. Is the government hospital ready to give a free medication?
Yes, free medication. Yeah, so it is a screening activity. Okay, so once we provided the education and then we do the screening, definitely we should expect to find one or two people who meet a certain criteria that will need attention. Yeah, so the hospital is available. In fact, today as well, we are promoting the Enchi College of Education clinic, which is also a collaboration between the hospital and then the college. So the staff are there. We have very experienced prescriber nurses that are there, that they are there to attend to students, staff, and then staff dependents. Yeah, so some of the issues that will come up here, they'll be able to manage there. Yeah, so that one, the college takes care of it. Yes, but those that are above them, we will send to the hospital. It's just a stone throw from here. So we'll give them the referral to the hospital and they will manage from there.
All right, thank you so much. We also realize that most of our students fear to come for the screening. What are your words to them?
Yeah, so look, it's better you know what your problem is and then you manage it. Like we say, prevention is better than cure. Yeah, so if there's a problem that is beginning, you need to pick up early and then take remedial action and get it covered. Like they say, a stage in time saves 9. So you should not be afraid to explore your own health. It's your body, you have only one. Yes, you need to find out how well your body is working. And then if there are problems, what can you do? Where did the problem come from? What can you do about it? And then now the problem is there, what is there that can be done so that it does not continue to progress and then cause a catastrophe. Okay, so for example, most people they have blood pressure. Until you put on the machine and then we check it, you will never know. But once you know and you take your medications, do some preventive activities, watching your diet, your weight, and some other things, the BP can go away for a while. Yes, if we need to give you medications to you know. If you didn't, it will be there, and the next thing you have a stroke. Yes, and that is more catastrophic. It's difficult to reverse stroke. So I'll tell them that they shouldn't fear, they should come. Some are afraid because they think their information will go out there. Yes, the work we do, confidentiality is very key. Yes, we all take oath not to disclose anybody's condition to even the school authorities. Just we and you, the students. So feel free and come, and your information is secure.
That's true. Confidentiality is key in this, in whatever they are doing here. So we want to move to the donation of blood side. So how is the whole process like? Does everyone qualifies to be donating blood?
Yes, so for students in the college, yes, almost everybody qualifies to be tested. Okay, so when we come, there's a questionnaire that will take you through, and then a few tests that we will do. If already your blood level is low, we cannot come and take that blood from you. Yes, so we check some of these things, and then those who qualify, we take their blood. Yes, in fact, most of you will qualify. For today, we need just about 30 units. So we will not be able to take that much because of our storage capacity. But we'll take down the names, and then every now and then, maybe the next quarter when we come around, those who couldn't donate can also donate. But for young men like yourself, every 3 months you can donate 1 unit of blood. Yes. Yes, it's quite healthy. Yes, and then we have some token of some food items that we provide when you do the donation. Yes, just as a token. So it's not an incentive for you to come and donate. It's just a token to refresh you. That's something small. Yeah.
All right. Thank you so much for watching. So that's from the medical doctor from Enchi Government Hospital. Thank you so much, Doc, for joining us.
Thank you.
And this is a wellness center. So you are checking the blood pressure and the sugar, and at the same time to the weight and the BMI.
Thank you so much for your time. All right, so that is it. The health screening is in section already. Moving to table by table to know what exactly goes on there. Please, good afternoon.
Afternoon.
Please, may I know your name?
Sandra.
All right, thank you, Miss Sandra. We'd like to ask you what exactly goes on at this particular table.
Usually the nose, the ear, and the throat.
All right, thank you so much for your time. All right, so we're heading towards the next table to know what exactly is going on there. Please, good afternoon.
Good afternoon.
Please, may I know your name?
I'm Thomas.
I'm Mr. Thomas. We'd like to know what exactly goes on here.
Oh, actually, this is ART, shortly for HIV. We screen HIV to know their status.
All right, thank you so much for your time. So that is exactly what goes on over here. They check your HIV status and know how best they can support you in any way. So moving straight to the next table. That is it. Please, good afternoon.
Good afternoon.
Please, may I know your name?
I'm called Paulina.
Paulina, all right, you're welcome to Enchicoe TV.
Thank you.
All right, so we want to know what exactly goes on here.
Okay, we are doing screening for the Enchicoe students. On this table particularly is dental screening we are doing here.
Dental screening. Can you give us a highlight about the dental?
Okay, we are going to examine and find out if we get cases like dental caries, abrasions, periodontitis, or gingivitis.
Right.
Compare them to the hospital for treatment.
Right. Thank you so much for your time. God bless you so much. So moving the house screening day here, we want to know what exactly goes on this particular table.
Okay, this table is designated for those who are going to do the eye assessment. I am for mental health. I'm in to assess students for their mental health related issues. Specifically, we have to do with things like addiction, something like drug or substance abuse, others like anxiety, some to phobia, and or any other thing relating to mental health issues. That's what we are going to do our assessment, or that's the areas we are going to look into. So that aside that, if maybe somebody have issues that need counseling, we can also do that for him or her.
All right. Thank you so much for your time. God bless you. All right. So good afternoon. Welcome to Enchicoe TV.
Good afternoon.
All right. Please, I'm what about you?
I'm Elijah. Here is eye in it. What we do is we check people's eye to see either they have refractive error or any kind of eye condition. Then it's either we refer them or we give them treatment.
All right, thank you so much. So, supposing someone comes here and the eye is not affected, are you ready to support that particular person with no charges from that particular person?
That is the reason why we are here.
So it means if somebody comes here ill, everything is free.
On our table, I'm being specific with my table. That is what we are doing. Everything here is free.
All right. Thank you so much for your time. God bless you.